Hello everyone, my name is Heather Daniel. I work at Wellstar West Georgia Medical Center. I'm sure if I were to ask you guys about how COVID-19 has affected you, I'm sure you would all be able to give me some type of unique story that didn't even pertain to work. It's been a year. The topic I want to talk about today is how this virus played a huge effect on mental health among healthcare workers. We were dealing with a virus that we knew little about. The spread was unreal. We had to go on lockdown, something we've never done before. It brought a lot of depression. We weren't able to have visitors in the hospital. To me, that was sad. I'm a people person. I like to have family members there so the patient feels comfortable. Sometimes they can add in, they may be able to tell you something that the patient can't. That was very sad to me that we weren't able to have them. We were forced into other areas that we probably weren't. At our hospital, we had redeployment, which is where you went to a different area to serve based off the need. That was scary because, like an OR nurse going to a med-surg floor, that's different. Just like if you were to be a med-surg nurse going to an OR, it's scary, it's different. There was a lack of education, there's a lack of resources. There's a million things that caused anxiety and fear and depression with this virus for us healthcare workers. At our hospital, we have a policy where before you clock in, you do a physical health check. You check your temperature. You go through a list of symptoms you may be having, like loss of taste, shortness of breath, cough, fever. If you were to say, yes, I'm having these, and you had a fever, you would go home and you would quarantine and you would take care of yourself. That's important for us, your colleagues, and your patients. I feel that along with the physical health assessment, there needs to be a mental health assessment, whether we do it maybe just weekly or daily, where we do a check-in, fill out some questions, and do a self-check where we are asking ourselves, are we suffering from anxiety? Are we suffering from depression? Are we having thoughts that we wouldn't normally have? Same thing we ask our patients when they come in. Are you having any suicidal thoughts? Have you lost interest in stuff you normally have interest in, like your hobbies? Because our mental health not only affects us, it affects the way we treat our patients, because if we're not mentally stable, we're not able to take care of these patients. We're not able to critically think like they need. We're not able to be quick and just do our jobs. It also affects our families, which it's a domino effect. You affect your patients, your family, your community, because let's just say you accidentally contaminated yourself when you went to Walmart. You need to be mentally there and well to do this. And I think it's important that we do assessments. And if we were to have an issue or answer so many questions on the questionnaire, let's just say I'm having symptoms of depression, I need to get help, and so do you guys, because we've got to take care of ourselves, guys. I feel that that's a policy that should be put in place. Maybe a CNO or CEO is listening right now, and they might think that's a good idea to implement, because it's just important as physical health assessment. Another policy recommendation I have is to let nurses who are in a high acuity of care, let them float maybe once a week. Just having the change of scenery, going, I only worked on the COVID unit, and that was very draining. Having the policy put in place where it says if this nurse asks or this CNA asks to be floated to a lower acuity just for one day a week, that they're able to do that. And I know that that's easier said than done because staffing is already short. But again, if your mental health is not okay, it's a domino effect. Those are just two suggestions I have. Mental health checks and the ability to float if you're feeling like your area is getting hard and you need a break. I hope everyone has a good evening. Stay safe and War Eagle.